Hi, and welcome to the Curious Cardiologist podcast. My name is Dr. Sanjay Bhojraj, board-certified interventional cardiologist and functional medicine practitioner. In this podcast, I'm going to look at old problems in new ways. We're going to have a series of guests who are going to force us to challenge the status quo and rethink the way we approach health. Because I found in conventional medicine, we really just treat things, but what we need to do is focus on healing. So if that sounds like something that you like, if you're a practitioner, if you are a patient, if you're someone who's just looking to optimize your health, you found the right place. I hope you enjoy this episode. Hey everybody, welcome to the Curious Cardiologist podcast. I am Dr. Sanjay Bhojraj, cardiologist who is trying to figure out what's going on in the world and looking at old disease states in new ways. And I am seriously so excited to talk to our guest today, Dr. Robin Rose. She is an MD by training and had some health issues herself, as a lot of us in the functional medicine world, has basically created a new approach to the old problem of chronic kidney disease and is really thinking of this in a really innovative and I think mind-blowing way. So Dr. Rose, thank you so much for being here.
Hey, thank you.
And I know it looks like you're in a horrible place right now. You're recording from Hawaii where you live. Is that right? Wow, awesome. Well, certainly, if you're living out there, probably a lot of the lifestyle things that we'll talk about down the road here, stress and detoxing from all the bad energies and stuff. But why don't we kind of hop in and talk a little bit about the kidneys in general? Because as a cardiologist, I think the conventional cardiology world and the nephrology world are always at battle with one another, right? Because of like heart failure. And we always think that people need more volume and the nephrologists want less, and we're pushing salt and they're pushing back, and all of our procedures take intravenous contrast, which can put the kidneys at risk. So a lot of times there's this really dicey interplay between the heart, the cardiac evaluation, and the kidney evaluation. But I think as we talk about organs of longevity, kidney is one of the essentials because it regulates so many different processes. What are your thoughts?
Exactly. I mean, I think of kidney as a root cause.
And people don't realize all the different things that kidney modulates. Now, for those of you who aren't docs, right? Number one, the thing that kidneys do is secrete our waste, and that creates by creating urine and getting rid of things. But there's so many other functions at play. Why don't Dr. Rose, why don't you go into some of your favorites?
One of the first things I think about is the kidney is the center of discernment. From a spiritual perspective, emulate that. It's like I call it the Raja Yoga organ because it decides what should I keep and what should I get rid of. And when it's declining, when it's not working perfectly, stuff's kept that can be bad, and getting rid of stuff that you need can happen. And so, that's the first thing is the discernment. And that's the kidney tubules, which is so where the action is. It's kind of my latest adventure. We're very focused on the glomerulus. And, there's glomerular filtration. And then everybody knows about, protein in the urine. That's serious. That often happens with diabetes and other things as well. And the tubules can also have proteinuria. And we don't even know it. We're not talking about this. And it's low molecular weight protein. So part of the discernment is when the tubules aren't working, you're losing stuff that you need.
Yeah, and I remember in medical school, it was so confusing to me. So in the kidney, you've got the glomerulus, right, where a lot of the water and waste products go, and then it goes through this tubule, this other set of pipes. And what happens in the tubules is you get reabsorption of things, right? So you get glucose coming back in, and it never made sense to me. You're throwing stuff away and then pulling it back in. Why would that make sense? Until someone told me, there are an infinite number of potential toxins that you can be exposed to, but there's only a finite number of things that you actually need. And so in a kind of kill them all and let God sort them out kind of a way, push everything out, but then just take back the things that you need. So all those infinite number of waste products can get pushed out. And I thought, wow, what an amazing design of an organ. Like what beautiful elegance and simplicity. And we don't talk about the spirituality of organs very often, but I like that you brought that in because there are bioenergetics and spiritualities to these different organs that in ancient traditions were really honored and revered. But we just,
Perfect.
unfortunately, we don't think of things that way anymore. And I think you said it right. It is the organ of discernment. It's one of the major organs that decides, self versus non-self. What do you need, and what should I keep, and what should I get rid of? I think that's a super interesting way to put that.
Toxins are often kept in the body. I mean, the tubules are kind of like the small intestine. There's decision making, there's transporters. The transporters get broken and then things go wrong. Too many toxins are kept in the body, you're going to notice it. And so, you know, that's of import. The glyphosate affects tubules, and, the heavy metals affect tubules. And so part of the drum I'm banging on lately is to get us all to be tuned in to these tubules. They're like amazing. And honestly, I'm still learning. I've been doing this for about a decade. I mean, I had my wake up call, it was 2013.
Well, let's talk a little bit about why all of a sudden the kidney became such an important and sacred organ for you. How did you come upon this, creating this field of renology?
I was Joanne Schmo, a regular family doc, not so regular. I was always a holistic doc, kind of, on the wave of functional medicine innovation. And I thought I knew what I was doing with kidney. Well, many years gone by, and I finally, I had a series of mishaps. My office manager embezzled my practice.
E.
No stress, big stress.
Wow.
In the middle of that, my dad got demented, and that was unbelievable dramas. I'm an only child, and so another thing, stress. My partner of many years physically assaulted me, and I left. I was like, no, that ain't happening. Ended up taking care of my mom, who died. So a lot of stresses. And then it turned into the rainbow and stars delightful dream of the life. I met my husband, life changed, we've traveled, we ended up here. On the way to moving here, I got a norovirus. Got the throwing up and the diarrhea and the dehydration, and got better, but never was better. And, early on in my life, I was a health food chef. I've been a yoga teacher, a meditation teacher. I mean, all these things that have been part of my normal world. I started spiking terribly high blood pressures, 220 over 110. And
Wow.
yeah, going.
And for those of you who don't know, that's where we start to worry about neurologic compromise. That's called hypertensive emergency, where you can, when you hear people popping aneurysms and blood vessels, that top number over 200, that's kind of what we're talking about. So
Yeah.
wow. So just all of a sudden in this post-viral state, you started getting these weird spasms, I guess, of blood pressure.
Acting weird, I was getting real emotional about things that seemed silly to me, but there I was, observing myself. It would come and go. I mean, I was doing some homeopathy, using acupuncture, blah, blah, could maintain kind of, but I went to see a newly trained integrative doc. She was the other one who got in my face and said, "Repeat after me, I am healthy." And I used one of those words I won't use on this thing and said, either you order a CAT scan or I will order it myself, and realized there's something seriously going on. And I had a renal carcinoma in my left kidney.
Wow. So, and how old were you when that was diagnosed?
Let's see, I was 63.
So here you are living this healthy lifestyle, eating correctly, organic, teaching yoga, teaching meditation. Definitely not one of the people that we would think would be at risk for these things.
Right?
And then after this viral illness, things just kind of got unbalanced, and that led you to this diagnosis of, did it end up being like a renal cell cancer, or was it
Yeah,
a cyst, or what was the
absolutely.
diagnosis?
Yeah,
So renal cell.
it was a
Wow.
rare form of it. So who knows? I had so many abnormal SNPs,
Mhm.
gene testing abnormalities, that who knows? However, I was clear. I wanted a nephrectomy. I just want this out. And I want to backtrack the stresses.
Oh yeah.
When you look at what are risks, that was enormous. I mean, if you add up all of my Holmes Rahe points over a series of maybe 5 years prior to that, it was significant. And I say that because it's important for us as clinicians to know that. Like, don't minimize when people are saying things are intense. That's physiology that is very dangerous. And
Well,
maybe it may be
and to your
reflecting the
point, yeah, we
pathology.
and to your point, as a cardiologist, one of the first questions we ask when somebody comes in with symptoms of chest pain or whatever is, what are you stressed? Right? We always you will always get asked that question, but then we don't have anything to follow up on that question, right? And you made a good point was that I call it the caregiver sandwich, where you're in this kind of in between of taking care of the generation above you, and if you have kids, the generation below you. And when you're in that 40 to 60 range, you're working hard, you're working at your peak of productivity and all these things. So everything kind of hits all at once, and of course nothing happens in isolation. So just like you had mentioned, oftentimes we'll have people that have two or three or four or five kind of dominoes fall, and I think that we need to be much more proactive about helping people manage that stress, utilizing therapy. Even as a cardiologist, looking back, there were times where I wish that I had put people in with a mental health professional. I think we need to kind of lower that threshold to get experts involved who can help people manage that stress, right? So I'm glad that you brought us back to that point.
Yeah. So post nephrectomy, I came here 3 weeks after surgery and went back to Oregon where I had practiced, and that's where I did the surgery and had my medical team, and found out I had a GFR of 30.
Okay. And for those of you, GFR, glomerular filtration rate, that is a measure of your kidney function. So that puts you at probably about 30 to 40% of normal for your age, I would guess. I'd have to do a
Actually, I see it as 25%. I use 120 as that's the highest optimal. And I can tell you some things about the for your age that I've
mhm.
learned along the way, which is really fascinating. I have
Let's go there because the
I
for
have
your age thing drives me crazy too. So
Okay,
go
well,
for it.
let me tell you this because, I got tired of going, well, what do you expect? All right, I'm going to be 75 this year. It's like I expect to have grace and vigor and take care of my wife and self and friends. So, anyway, I was on a call with Joe Pizzorno, who's a naturopath and a toxicology expert, and Linda Frazzetto, who's a wonderful nephrologist from UCSF, the one who's really taught us that alkalinizing matters with kidney.
Okay.
And so the three of us were having a conversation on a Zoom call. And she said that, well, what do you expect at your age, kind of thing. And Joe, to his credit, said, well, we don't monitor toxins. And that's what is causing the kidney decline, not the timeline. I have a husband who's year and a half younger than me. His GFR is 100.
Wow.
So, and of one case, but I see that often. It's not necessary that kidney function declines with age, but it's true that life harms us, whether it's stress or toxins or medications, cardiology procedures, all these things that are,
We always get blamed for everything by the nephrologists.
you save lives though. So
Yeah.
you get the pass.
Well, and to your point, we just assume that things start to go bad as we get older. And I think, maybe we can have a discussion about what your thoughts. Is aging a disease? Is it a medical condition that we can treat? Like some of these things, like as you mentioned, renal dysfunction, there may be things that we can do. I mean, I think about, in the conventional world, ACE inhibitors and SGLT2 inhibitors and all these medicines that are to prevent or protect kidney function, right? So is it irresponsible of doctors to say of anything, oh well, what do you expect for your age? Right? Or is it something that we're open to, but maybe have to think about the slope of deterioration? Like you're above and beyond what I would expect with just age, there's something else going on, or is it that we don't need to worry about deterioration, as long as we're using things, as we'll talk about, like biooptimizers, and you and I when we got on, we're talking about Clotho proteins and things like that. Is this something that we can overcome?
I think so. I mean, we see people who live into their 100 and seem to have vigor and mental stamina. And so I think Joe was right that it's those stressors to the physiology which we're obliged to seek. And, that's why I like the idea of longevity medicine. But when I think about it, really, it's treating early pathology. And I talk about listen to the whispers. As a family doc, that's where my expertise comes in. What does this pattern feel like to me? Because there's some intuitive to the intelligence. So, often I'll see people who are like, oh, I have all these problems. Well, how are you eating? You're eating bad. Okay, well, this is free medicine. You can change how you're eating. How is your sleep? It's an enormous thing, and so many people don't do the basics. I call it harvesting the low-hanging fruit from the tree of lifestyle.
That's so as we, and I'm a huge proponent of diet and lifestyle changes. I think that it is essential. I run a metabolic program, diet and lifestyle program, and I would say 80% to 90% of people get better in terms of cardiovascular issues like insulin resistance and blood pressure, and you see improvements in triglycerides and things. And so we really need to appreciate that more. Let's bounce back here to the diet aspect of things. And so what are some of the foods that you feel maybe therapeutic? Do you promote organics? Do you think that it makes a difference? Like what are some of the foods that we can eat? And in particular, I've been asked this several times, and as someone who's more in the renal space than I am, but do we really need to be concerned about protein intake for someone that has some degree of renal compromise, of kidney compromise?
Yeah. Well, one thing I want to say is, by the way, with all of the things that I've done, my GFR with one kidney has been consistently 68.
Which is good even for people that have two kidneys,
Exactly.
right? By conventional
What they
medical
call normal.
assessment.
They would say, what are you worried about? And
Yeah.
I'm not worried, but I'm aware and diligent. I don't take that lightly. Diet is like, the cornerstone. And I don't believe that people cheat. Oh, I'm cheat. You don't cheat. We choose. We're adults. We make choices. And sometimes maybe the choices aren't perfect, but it's always, and yes, I think organic matters. In the book, I have a chapter on glyphosate and heavy metals. All of those things actually are troubling to kidney tubules. And when the kidney tubules aren't working, we basically get rusty and scarred, as the most simplistic way of saying, oxidative stress and inflammation and fibrosis.
And glycosylation, I think, with high sugar diets and high glycemic index diets,
Absolutely.
certainly comes to play. And it's a theme that we hear a lot on the podcast is, what are the things that kill you? It's oxidative stress, inflammation,
Exactly.
Glycosylation of our proteins, like rusting and caramelizing from the inside out. It's crazy. So let's talk a little bit about your work. And I know that
But I
you've
want
written
to
a
tell you
book.
about my idea about protein, because I really do. You asked.
Oh yeah, let's get into that. Yeah.
I can remember. I believe that excessive protein can be harmful. I'm a proponent of the zero 0.6 to 0.8 grams per kilo optimal weight. Everybody's different. Sometimes people are really sarcopenic. They've lost their muscle. Might go up to 1 gram per kilo. But I've seen incredible improvements when people just back off. And using Chronometer, which is an app you can get on your phone, you can get it, on your computer. It's amazing. It's an annoyance. It's a pain in the rear end to do it, but it is so worth it. It's crazy. I mean, if you say like, okay, you should have, 40 grams of protein. What does that mean? You don't know it, this much protein, what does that mean?
How do you quantify that? Yeah,
Actually,
exactly.
and what I found was there's protein in rice and broccoli. There's protein in other foods, and so people with kidney issues need to know they might be eating too much protein, which just puts a nitrogen stress and also an acid stress on the body. And so alkalinizing is enormous. And if you eat a plant dominant diet, you're more likely to stay alkaline. You look at the CO2 on labs, it's just a moment in time, mind you. If you did
On
it
a basic metabolic panel, yeah.
every hour, it might be different, but I'll see trends, and I like to see the CO2 close to 30. And
Okay.
so they'll say, oh, it's 22, it's fine. And what I see then is if you eat lots of veggies, and you got to know what your labs are, because some people have high potassium, you got to be careful. Some people have high phosphorus. And sidebar, normal range of phosphorus, halfway is where the high normal is in kidney. So if it's 3.5 and above, there's a whole long conversation. And phosphorus elevation equals cardiovascular drama.
I mean, like in the sense of cardiovascular calcifications and things like that,
Yeah,
for
like
sure.
things
So,
nobody
so
wants.
So as you talk about alkalizing, just what do you think about alkaline water? Does that make a difference? I always just assume that your pH of your stomach is 3.5 or whatever it is. And so, there's this big health trend towards drinking alkaline water. Do you find that that makes a difference? Is that
I
something
can't
related? Or are you
compare.
talking more about kind of as an entire dietary plan, eating more plant-based to kind of alkalinize, not necessarily that alkaline water would have an effect?
I think the ritual of it, like this is helping me, is really valuable. Again, the mind body, the spirit connection, overcoming fear. Fear is huge, and it's in Chinese medicine, kidney is fear. And so it's like, this is helping me, has some benefits. So that's one thing. Really, it's the overall diet. More fiber, more fruits and vegetables, not too much fruit because then you have fructose, which is a whole nother conversation. But lowering or eliminating grain can be remarkable. And eliminating red meat. Does that mean never? Maybe not, but, you know, for myself, I was advised to eat a lot of meat at the beginning, and I didn't get better. As soon as I hopped on the tofu wagon, and I'm a wonderful tofu chef, by the way. I love tofu. And started using, more ethnic vegan kinds of options. My GFR hopped up to 40 pretty quickly. I've seen that in a lot of people. And as you alkalinize, there might be elevated parathyroid hormone that can normalize. There might be, potassium is modulated by alkalinizing. So is phosphorus. So is uric acid.
So that's this whole knee bone connected to thigh bone. Everything is related, but it does a lot of it. I think you're right. It starts with diet, starts with lifestyle changes that become super important. I think that's kind of spot on. So let's talk about bioregulators. I know that a lot of people.
Did I do this yet?
Yeah, that's the book that you've written.
And here's my weightlifting material.
Yeah, how much does that book weigh? Someone said 50 pounds. I don't know about that, but
Probably not that much.
it looks legitimate. So you've written this book. So a lot of listeners are familiar with peptides, right? And anybody who knows what insulin is or, semaglutide, these are peptides. These are short chains of proteins of amino acids that have these biologic effects, be it healing or not healing. And the world of peptides is a lot of what we talk about in functional medicine, integrative medicine, BPC 157 and the thymosin and all of these that are kind of more, ready for prime time. A lot of people are more aware of them, but these biomodulators that you talk about, this is a whole separate set, right? So why don't we dive into that a little bit and,
So I
and kind
grew
of
up being a
unpackage.
dancer, and I'll show you. Here's a protein, big, all wrapped around itself. The peptide might be, this piece, smaller piece of a protein, but big enough that it needs to be injected. Just like insulin is a subcutaneous injection. They're big enough that's required. BPC comes from the stomach, so it can be oral. But basically, most of that class is too big to be an oral supplement. Bioregulators, however, are like this little piece of that. They're basically 2 to 4 to 7 amino acids, so a very tiny.
Really small.
Yeah, and so very
Wow.
agile. They get in the cell without needing a receptor. There's transporters, so they get in the cell readily without an energy cost, get in the nucleus. And here's what they actually do. Bioregulators are gene switches. They get in the DNA, they stretch it open, and they repair epigenetic damage.
Wow. So as short as 2 amino acids can get in to the DNA and lead to repair. Wow.
And there's a huge body of research. I mean, these came out of Russia. I mean, the story is kind of fun to tell. There was a man, Professor Havinson, who when he was in the military, he was a gerontologist by training, and he was ordered by the Soviet military to discover substances to protect their military from American military, from, radiation and bioweapons. And he did. And when he was out of the military, he was funded enormously with an institute to continue the research, which started in the 70s. So this has been going on a while. And until the Soviet fell apart, they had unlimited funding and did ton. And I've packed a lot of that in here because I wanted to know, the sidebar is when I first found out about peptides, I like jerked myself out of my clouds and went, I want this. And then I did the same thing finding out about the bioregulators and was part of a study by Dr. Bill Lawrence, who's replicating some of the Russian work. He's worked with them and has been. And that's a longevity study. But like I said, longevity means you're diminishing pathology, maybe the early whispers. And so the bioregulators are really work on pathways that lead to the fibrosis and inflammation and senescence. So they're really amazing. They're very identical to human chemistry, so the body doesn't recognize it as foreign. So their side effects are basically nil. It's considered a supplement, so the oral ones, there are injectable ones. They're a little bit harder to come by, but they are available. And yet, as a sort of pedestrian way of approaching peptides, the oral bioregulator peptides are fabulous. And there's many. So, there's brain, there's pineal, there's retina, there's thyroid, thymus, blood vessel, heart, lung, adrenal, kidney, pancreas, muscle cartilage, bone marrow.
You name it, there's a bioregulator for it, it sounds like.
And so you cycle them and the point of my book, which was what these things really taught me, is the kidney is in axis with all of these tissues. There's eye decline when there's kidney decline. The inflammatory and blood vessel connections are real. That we know there's specific brain issues. The thyroid declines in a unique way with kidney. The thymus is huge. All of these things are really opening our head to a more holistic perspective about kidney, a paradigm shift, really, from, well, the filtration's okay, you're fine.
Right. Well, and getting back to the kidney, you kind of mentioned it, but stage 2 or these early stages are the canary in the coal mine, right? Where often that's the time to step in and intervene. For cardiac, I mentioned I was an interventional cardiologist, or I guess I still am, but we were the end user of the complete broken system because you didn't see me until you had a heart attack. And that's what kind of drew me into functional medicine is what are the 10,000 things that happened before this cardiac event that we could have turned left when we turned right or turned right when we turned left. So, and I don't think we have that approach to renal disease, right? And we wait till someone is like end stage before we start to do things. And I think we talked about proteinuria. So why don't we talk a little bit about what that means, microalbumin and is that really a good marker of when we should intervene, or is that a step too late? We need to get in before you start to see protein spilling in the urine to
I like
engage
that.
some of these
And it's
bioregulatory,
too late.
bioregulators and things.
I mean, it's too late, but it isn't. I mean, I just reviewed a case today, a kid with Crohn's, yeah, 19-year-old, so kid to me for sure, with a seizure disorder, and they just found out he's in stage 4. Nobody had ever mentioned before. I mean, give me a break, when there's autoimmune disease, inflammation, and then we didn't really talk about dysbiosis. There's unique dysbiosis. Uremic toxins is a whole conversation. We have a few. No, we have gazillion. And so things that might be safe for people who have normal kidney function are really a danger to people who don't. And so anyway, I hate that we wait this long. I have this like Jersey girl, like, what are you waiting for? Because that was my question. Like, how come I didn't know?
Yeah.
And I looked, I mean, I'd been in stage two, not including me. Nobody knew before all this. I mean, who knows if I could have intervened. And so, what we know in stage two is there's endothelial dysfunction, there's dysbiosis, there's mitochondrial dysfunction, there's tubular dysfunction from heavy metals and toxins. I'm probably leaving, and there's glycotoxicity. I mean, it's actually all happening, kind of subtle. And yet,
Hmm.
preclinical doesn't mean it doesn't exist. I was told, well, we don't do that because we don't really have a pharmaceutical for it. That's changing in a way. I mean, the GLP-1s and the SGLTs are helpful, and ACE inhibitors have a place. And
Yeah.
so
Well, and I think to your point is that you kind of mentioned in there, if we don't have a pharmacologic therapy, the mindset of the conventional doctor is, well, we just let it ride. But you also mentioned the importance of really meaningful dietary and lifestyle interventions at that stage two that can, I don't know if I could necessarily say put you back into stage one, or get you off of the treadmill, the spectrum of kidney disease, but at least prevent it from progressing. And that's what frustrates me so much about the conventional medicine world, is that we just have no training in that diet, in that lifestyle. And that's, I think, so much of the way I at least approach functional medicine is really kind of zoning in on that diet, that lifestyle. As we get back to the bioregulatory peptides or bioregulators, when is the right time to engage them, in particularly in the spectrum of chronic kidney disease? Do we start at stage two? Do we wait till stage four? Like, what is the right time? Obviously, but do you wait till the kidneys are dead and then start it? But what is the right timing? How do we approach this? I think of like double Dutch jump rope. Like the hardest part is just figuring out when to get in the two swirling jump ropes. So when is the right time to engage these bioregulators? I guess particularly in the setting of chronic kidney disease.
yeah, well, it depends on what the portal in, because there's various portals that people enter to experience decline in kidney function. And so if it's cardio, okay, we have lots to do for cardio. You can use the blood vessel and heart, if it's lipids involved, liver, if there's brain effects, gee, I'm fatigued, I can't think clearly, brain. And, I think dropping Pilotax is the name of the kidney bioregulator. It's not a every single day drug, and that's important. It's not a pill for ill. And so
Mm-hmm.
you kind of collage these. They call them bundling them. You might do 4 at a time, but some of them are 10 days at a time. And then the clinician and the patient can work together. How intense is this case? Do we want to do this every month? Do we want to do it every 3 months? And you can cycle a lot of those over time. You just have to create a protocol, and I personalize those. So is it autoimmune? There's thymic peptides, the pineal peptides are amazing. That works with sleep issues, entryway. People with gut issues and dysbiosis might start seeing the little bit of decline. And you can make the assumption, I mean, as primary care, a little bit of cowgirl to it. It's like use my education to say, okay, I don't need to spend $1,000 to say, with all of what you have going on, your kidneys need protection. And because these are safe, you can use them as a prevention before it breaks, which is lovely. I mean,
That's awesome. Yeah.
yeah. And so, and they also work even more better, as we say in Hawaii, they're more better for elders who have sustained decades of who knows what. And so in time, it unravels it. But, you can't just, okay, I took 10 days, I'm good now. It's not like, you have strep throat and you took your penicillin for a week and everything's fine.
Right.
It's really, it takes a long time to get there. And so, in the meantime, it's really about taking time with people. Having a really good history form helps because then you can see, where they are. But, I don't think dropping off a patient to the dietitian and not really the physician taking the time to say, diet is medicine with a big M. Here's how we treat. How are you moving your body? How's the joy in your life? How are you driving your vehicle in regards to the assault of life, basically?
And like, what are your social connections? What's your sense of community? Do you feel part of something bigger? I mean, all of these things kind of, and you mentioned before that in traditional Chinese medicine, that fear is housed in the kidney, right? So I think a big question that kind of changed my discussion with patients was the simple question, do you feel safe? And it's amazing. And like, what do you mean? I'm like, just in general, like, is there anything that prevents you from feeling safe in your life?
Mm.
Simple question. It's kind of disarming, right? It's kind of like it's like a left hook. You don't really see it coming, but it really opens up a lot of interesting discussion with my patients
I
and
love
clients, at least, because they just like, you know what? I don't really talk about this much, but XYZ, my relationship stress or my work, or I had these adverse childhood events that happen, these ACEs that happen, and I never really resolved. And that's where, that's not a question a cardiologist is going to ask you generally, 99 times out of 100, but as we look at the entire patient, the whole patient, we have to take these things into account. I certainly think that that's part of it. So,
because
what are some of
the autonomic effect
right?
in kidney disease is huge, and so all of these things, if you haven't resolved all of your stuff and you're living in fear instead of awe, then there's catecholamines, there's like stress hormones that are actually adding to the cardiovascular and renal and metabolic damage. And so it actually matters if you're walking around pissed off about everything and not knowing how to turn that off.
How to deregulate. And if you don't think kidneys are important in blood pressure and these afferent nerves and the vagus nerve, I mean, there is a huge
Foods.
kind of push in the cardiology world to do something called renal nerve denervation, where you go into the renal artery and either through ultrasound or radio frequency ablate the vagus nerve to bring the blood pressure down. It's a classic example of the cardiology thought of the knee bone is connected to the knee, right? I always wondered, what are all the other systemic effects that may happen when you start ablating the vagal nerve afferents, and what other havoc might you be wreaking? But getting back, so you mentioned kind of personalizing these protocols. Are there like biomarkers that you like to check, like either blood or urine markers to kind of see where people are at? Do you just follow creatinine? Like what are some of the things that you've learned about for our practitioners out there who are listening?
Yeah.
What are some of the biomarkers that you like to check to kind of assess where people are,
Yeah.
not just as an initial assessment, but as an ongoing with therapies of these biomodulators?
Many. There's many. And again, personalized because it depends on the portal. Because we know more to do about autoimmunity. Or so, with that in mind, I like a GFR over time. Is it perfect? Absolutely not. Cystatin C is helpful. Sometimes you can compare them. They're often similar, often discrepant. It depends on muscle, as does creatinine. I like creatinine, but again, by the time it budges, you've already lost 20%. So it's like if you see a little bit, okay, let's have a conversation. We don't want you to turn into somebody who needs to go see the dialysis center ever. And
Yeah,
so,
and it's affected by muscle mass and so many different things. I think
yeah,
that's the benefit of cystatin, right? Is
yeah.
that you really don't, it doesn't depend on that.
And so from a basic panel, you look at how's the glucose. That's, ballpark in it. Sodium, potassium, chloride. If there's discrepancy with sodium and chloride, okay, there's tubule stuff going on. The CO2 is enormous. I like to know what the uric acid is. Absolutely have to know what the phosphorus is. And 3.5 and above is not normal. Start dealing. You don't want blood vessels to turn into little bones. And that's basically it sucks
Yeah,
calcium from. Yeah, phosphorus is
phos is
huge.
interesting. If it's too low, you have problems generating ATP, right? Adenosine triphosphate, right? So energy goes down. And I remember from my conventional training, that was one of the things you have to think about when you can't get somebody off a ventilator is Do they have enough phos? Can they make ATP to generate, like, we talk about mitochondrial dysfunction. This is like the nth degree of mitochondrial dysfunction. So what are some of the, are there specific bioregulators that you
But
use,
there's some
or?
more. Let me finish my list because this is
All
important
right.
to the clinicians. TMAO, homocysteine, and ADMA. All cardio. Remember, cardio, what takes out the masses of CKD patients. And so, these things matter. Advanced lipid panels. Okay.
I just call them comprehensive. I don't even think they're advanced anymore. I think they should be
Like
standard of care, but
that.
that's just me.
No, I thank you. I'm into words. I love that. I like a heavy metal panel. I like a Nutrival panel. And
Looking for micronutrient deficiencies.
and it's amazing how, oh my God, things are all over the place. So it gives you stuff to do, from diet, from supplementing. And there are a lot of supplements that are amazing, and there are a lot of botanicals that are amazing, and they're safe. I'm working on writing about that stuff as well because we need to know this. Let's see what else. My latest delight in testing is knowing about tubules because it's absolutely neglected. And so I learned this from a Chinese nephrologist, beta 2 microglobulin. You can order it. I have. When it's elevated, it says that too many low molecular weight proteins are getting into the urine instead of resorbed in the tubules.
Okay, so you're leaking too many of these proteins.
And
So there's tubular dysfunctions. It's a mark of tubular
tubular
dysfunction.
proteinuria. And so I just learned this. I love this because it's like, we're shifting the paradigm. There's more to know than just get a GFR. It's kind of like, your TSH is fine. See ya.
Right. Well, it's amazing. It's almost overwhelming as a doctor. You just have to accept that you're never going to know everything, right? And there's always something new, and what you believed in yesterday, you can't believe in today. And so it's a really interesting kind of data set, to kind of learn about new things. And actually, one of the new things that I work with is the Clotho protein, and to my surprise, you'd actually heard of that before. So Clotho is a protein actually secreted. Kind of where it was discovered was in the proximal renal tubule. So in the kind of upstream part of the renal tubule, and it's it regulates a lot of different things: calcium, phosphorus, metabolism, for instance, activation of vitamin D, fibrosis, all sorts of things. So what do you see, or from your knowledge of Clotho, or I guess if you're from an East Coast, people pronounce it Clotho out there. I give it the Midwest long O, Clotho, but as a protein, as a marker, as a potential therapeutic agent, what are your thoughts about Clotho protein? I
think it's the next frontier. I would love to see everybody with CKD have access to it. And so I've been working with Fiona Chin, who's a naturopath from Australia who does kidney medicine, and we're doing a series of talks. So we talked about blood vessel bioregulators just earlier this week. So I really got to understand how when the phosphorus is elevated, the FGF23 gets elevated, another lab to consider, and I think it's important to know. And yes, do it cyclically, depending on the patient and how often. FGF23 has to bind with Clotho to be safe and protect the person against rising phosphorus, which we depend on for life, but too much and too little is not good. So the Clotho comes in and basically protects the damage that FGF23 is going to do to the cardiovascular system and inflammatory changes. The get out of jail free card as far as I'm concerned.
Yeah, I did a lecture this year at the Institute of Functional Medicine's annual conference on Clotho, the most important marker of longevity and health that you've never heard of. And, you talk about brain health. It helps clear plaques, and tau proteins from the brain. So you can improve Alzheimer's. It helps improve, I'm just going to go head to toe. It helps improve oxidative stress and substantia nigra, pars reticula for our Parkinson's patients, can help reverse dopamine or Parkinson's. These are in animal models, but even in humans, we see that steady decline in Clotho is associated with renal outcomes and cardiovascular outcomes and mortality. And so there's this huge push now. Like I said, I'm part of a startup that does this through a bioelectric suit or gene therapy or even nutraceutical supplementation. Fisetin comes to mind as something that that can boost Clotho. So I think it's,
and many of the bioregulators do, I'm finding.
Yeah, I need to pull you into my team over there so we can have a discussion,
Love
because
that.
it's so fascinating, this world. So, boy, is there anything bioregulators don't do? I mean, these things sound amazing. Like, why haven't we heard of them? Like, why is it like in the back of secret societies? Like, why is this something that even, maybe not the conventional world, because obviously big pharma and whatnot, but as functional medicine and integrative doctors, should we be having a greater conversation around bioregulators? And,
I think so.
should everybody be buying your book? It should be an Amazon bestseller.
Are you in? I have a peptide group on Facebook.
Peptide docs or pep docs?
Pep doc. And so, other people talk more about the bigger peptides. I'm obsessed. I love these. I mean, it's amazing. I mean, they really impress me. And I also am a big proponent of the other peptides. I mean, SS31 for kidney, gorgeous. Thymus support one way or the other, whether it's injected or oral. BPC is a love affair. I mean, there's many. I mean, I found out about BPC on Facebook, observing a conversation in a functional group with Beth Shirley, who's brilliant. She's a PhD pharmacy nutrition, lovely woman. And she was telling somebody else with dysbiosis who couldn't get their nitric oxide level up to use BPC. And I had this, want this?
What is it? Yeah.
I got some. I have a compounding pharmacist, and I sat there for a month with it and studied because I need to know, is this safe for kidney or not? I know it is. And of course, there's always, every person is unique. So, biohacking is biohacking, but you got to know some stuff. And so I had a damaged distal colon from my nephrectomy, which actually set me up for years with morning misery.
Mm.
Leave it at that. Use your imagination. And I finally, after reading for a month, my husband is a nurse, and I said, right there, I have this pain here, which I thought was the other side of the adhesions. Shoot that stuff right there. So he did this.
The peptide, the BPC,
Yeah, the
like
BPC.
peptide,
So
just put it right
there's
local, right in there.
you right where I was having discomfort. The next morning, I got up, went in the bathroom, did my bathroom thing, brushed my teeth, washed my hands and face, and went about my business, as opposed to a 2-hour visit to the back room there. And so it's an amazing tool. And for GI changes, it's not the only one, but wow. And again, that was my question. Like, what doesn't BPC do?
I
The
mean,
array is crazy.
seems to so many things. And as I think about the menu of peptides, I think number one, there's a lot of letters and numbers, right? Like BPC 157, SGQ 9449. And so I think that can be intimidating. I mean, honestly, that can be intimidating. And there's just so many of them, right? That you want to know. And I live here in California, and they have weirdo rules in California, but it really does seem like an amazing therapy. And again, for those people who might be peptide averse, the GLP-1 receptor agonists, all of these are peptides. They just happen to be pharmacologic ones. So people are using, I don't know, what's the statistic? 1 in 8 people now in the United States is on Ozempic or some crazy number like that. So they're being used therapeutically. And so I think it's amazing that in the functional medicine community, I think of us, number one is applied biochemistry, right? We're really looking at the biochemistry of what's happening in cells and closing that translation gap between what PhD type people are discovering in their labs and what the MDs are able to do at the bedside, but also really beating the drum on some of these emerging therapies and being early adopters, of course, with the aim of patient safety first. None of us want anything bad to happen to our patients, but we are a little bit more engaged with some of these less conventional, less traditional things that can be, I think, sometimes even more impactful than what we do in the conventional world.
And they complement them. Like many botanicals actually enhance the benefits by filling out the physiologic bang. I mean, it actually makes it better. And some of the studies from Russia showed that. And to one of your questions, I don't know if this is so, but I'm going to say we didn't like the Russians,
Mm.
America. And so that has been a thing.
Well, I mean, when you think about human performance, certainly, the Russian scientists, I mean, we think back to the Olympics and performing enhancing drugs and all of these things,
They
but I
were
think a lot
using
of what we know,
bioregulators.
yeah, I mean, I think a lot of what we know about human performance and peptides, you know, comes from scientists from a country that probably we don't want to be associated with, right, politically or otherwise. And so, unfortunately, they get kind of these discoveries that are so important for humanity get swept under the rug, I guess, but they don't necessarily need to be.
I know. I mean, I'm in email touch with the pediatrician wife of the man who discovered these. Neither of us could care less what each other's government is doing. Our emails are, "How are you doing?" and "Where have you gone on vacation?" And this bit of research that I discovered. What do you think? I mean, it's an interesting concept that we have international cooperation for things that are truly humanitarian intended.
Yeah, I mean, I remember in the cath lab, I would say all hearts are pink on the inside, right? No matter what the outside looks like, it's
Exactly.
all like it's not like for one ethnic group I have to look over here for this artery, and for another one I have to look. We're all built the same on the inside. The chassis is the same. It's just the paint color is a little bit different. But yeah, I mean, I think we need to do that. So, in terms of education, if we have practitioners out there, where so you have your book that's available for practice, and it's really a guide written for practitioners, from what I
Yeah.
understand. Is that
I,
not
I
not like
mean,
a
other
layman kind
people
of
are
thing?
getting it. I mean, my website is rhenologyiskidneysuccess.com. And I didn't say this on here. I coined rhenology as a limbic system reclaim. My oncologist, who's an integrative, wonderful, brilliant woman, basically was like, don't use the word failure. She was really intense about that. And I said, thank you, I hear you. Nephrology started saying, people don't know what the word renal means. We're not going to use it. And I was like, I'll take it.
Got it.
And
I
so
got
I
it.
got
Yeah.
it. And I said, wait a minute, renology is the art and clinical science of kidney success.
I mean, it just
Many
frames it
changes
completely differently.
it does. People will send me a note saying, I'm in stage 4 and can I get better? And it's like, well, yes, you can. And what's it worth to you? So, so I've kind of entered this as like, this is a yoga. Instead of being a kidney warrior, I want to be a kidney yogi. I want the discipline to do what I need to do and do it joyously rather than like, "Nah, I can't eat this, I gotta eat that." Nyeh, nyeh, nyeh." I mean, that's and I've been there. I mean, I'm humble. I mean, I've had fear, I've had grief, I've been pissed off about all of it. And I don't want to linger there. I want to live in joy because, joy and heart is definitely. So, with the book, I couldn't stop adding things. So, I have a whole section which really elaborates on some of the new paradigm, like how else to think about kidney. And it's, I could have done this for the next 40 years. There's so much information. I had to stop at a point. And that's why I said I'm going to limit it. Like this is about bioregulators, but it really is about the whole body. People who are getting it are saying it's helpful to them, even though some stuff they got to look up. I had to look it up. A lot of these new molecules, I didn't know what they were. Now we have, God, I mean, all you need to do is go ask ChatGPT and you get a whole lecture about stuff cautiously because sometimes they're wrong. But
Yeah, I haven't gone to chat yet to explain peptides, but I mean, there's the menu. You're right, just keeps getting longer and longer, and it's more fascinating. But I think even more important, why as clinicians we need to, at least start by starting right, start somewhere, just like you did with BPC, is just get familiar with one, right, and then advance from there, right? I mean, you didn't,
exactly, that's
it was
what I did. I mean, and I was doing it like every single peptide. What about kidney? Nobody else was doing that. And that's why I thought, I need to find this. I need to create this information because there is a kidney demic. And when you include stage 2, it's even more alarming. I've seen like 10% up to like 20% of the population, which is higher, higher, higher in elders because, yeah, you've had, I used to walk down the street in New York breathing bus fumes thinking I was in heaven. Yeah, I had a high lead level.
well, and to your point about the kidney demic, is that what you called
Yeah,
it?
call it a kidney demic.
Kidney demic is that when that there's a paper from the University of Utah that said 93% of Americans are metabolically unhealthy, kind of taking it back to that CKM. Certainly as an interventional cardiologist, what I saw during my cath lab career was we went from these people whose main risk factor was smoking, right, where they had discrete lesions. I'd call them spot welds that I have to go in and just fix, a short 12 millimeter segment of vessel, to what we see with the metabolic diseases is it's much more systemic, right? The entire vessel from stem to stern is affected. And I was putting in 35, 40, 50 millimeters of stent, which I know most of our audience doesn't have a frame of reference, but that's a lot of metal to be putting in an artery, and so, these are things that we have to be concerned about. And I think that as an organ of longevity, unfortunately, the kidney is always, for some reason, not given as much respect as it needs to be. But, as an organ of longevity, the kidney is one of the most important. Just look at the mortality rate of people who go on dialysis, right? It's like 50% in 5 years or some ridiculous number. I mean, I'm sure that somebody can fact check me and put it in the comments, but, it is not a condition without significant morbidity to have chronic kidney disease and end stage renal disease where requiring dialysis. So, I think a fascinating discussion. Certainly, I can't wait to get my hands on a copy of the book to kind of learn a little bit more. We'll get it sent over, and I like the cover art. Did you do that yourself?
Beautiful. No, I tried and tried and tried. I couldn't quite get it. And a friend of mine wrote a book on a very different subject, and I loved the cover art. And I got in touch with, he's Ukrainian, living in Poland at the moment. And this was the second or third try. His first one looked a little too much like Hustler magazine for me. And so
Like Hustler magazine?
we
Is that
had to like flatten out the pointy boobs. But after
Man.
he heard it, I love it because, it's like,
it looks happy, like there's joy coming from the emotion that's created by the artwork. So I love it. I think it's absolutely fascinating. All right, I always end the podcast with a couple of getting to know you questions, and I'd love to hear your thoughts. So number one, what is the most surprising place you've ever been to? Like someone meets Dr. Rose, and I would never have thought in a million years that she has been to.
I'll say Goa.
Hey, that's my mom grew up right side of Goa. So that's on the seaside in India, and it's become like a party town for Euro people, right? It's like gonna be big EDM Goa trance thing. So yeah, it's awesome. Yeah,
When I was there, it was a fishing village that I lived in, and there were some wandering sadhus who were very interesting, and there was a smattering of us outsiders, and I was probably the beginning. This was like 1970, so it aged
wow.
me a bit. The beginning of what I actually grieve. I don't know how your family feels about it, but when I see some of what's going on, it's like, how are the young girls that I remember from the village dealing with all of this?
Oh, well, that's a whole other podcast probably. Number two, what's your favorite food? What's your favorite thing to eat? Something that you could eat all day, all night long.
Tofu.
Tofu. Oh, you mentioned, and there it sounds like you can. It's funny you mentioned about tofu and being vegan and ethnic, herbs and spices and things. Was like when was this? Probably about 15 years ago when that Forks Over Knives documentary came out. I decided, what, I'm going to try being vegan, and so I went out and got a vegan cookbook, and it turns out like 90% of the recipes in the book I got were Indian food, and I realized. I didn't realize I was vegan for like the first 14 years of my life, like growing up with my mom, because outside of the occasional fish recipe, because she grew up in the fishing village, like I was like, wow, I was pretty vegan. I didn't realize that. And then finally, if you had one book to read for the rest of your life, again, and it can't be your own book, all right, one book that you could just read over and over and over again, what would it be?
Oh dear, I can't even imagine.
All right, well, we'll send it back and we'll put it in the show notes. For me, I think it would be 100 Years of Solitude. Have you ever read that by Gabriel Garcia Marquez? Fascinating, lovely book. I remember reading it and I read it again and again and again. I absolutely love it. Well, Dr. Rose, thank you so much for being here. I mean, this was a super enlightening discussion, and exactly what I love talking about is a completely new approach. Although we say new, the bioregulators started in the 70s, as you mentioned, but a new, different approach to kidney disease. And in the conventional world, when we think of kidney disease, most people just think it's a train to dialysisville, right? But I love that there are things that we can do: dietary interventions, lifestyle interventions, and now these biomodulator peptides, these bioregulatory peptides that can be added into the mix to really try and Clotho, of course, we can't forget Clotho, to actually maybe reverse some of this. So I think it's absolutely fascinating. If people want to find you, where do you exist? You mentioned your website, but
There's a contact on the website, which is rhenologyiskidneysuccess.com. That's where to get the book. We decided to avoid that whole game with the Amazon thing, and I really didn't. I wanted to be my own editor. I mean, I had many assistants, but I didn't. I had publishers who would go, "I don't want to take this," and it's like, no, no, no. I'm fussy. I want it the way I want it. And there's a lot of podcasts that I've done. So some of them depends on who I'm talking to. They're a little different. I've been writing some blogs and with cool stuff. As I'm discovering things, I'm like, look at this. One of the first ones I did was on cardamom. Cardamom is wonderful medicine. Quarter teaspoon a day. It's in my cup. It gets diluted all day. And it really is a cardiorenal friend.
it's nature is amazing, isn't it? Like I just absolutely the things that exist in nature, like you live in Hawaii, so like bromelain from pineapple, like I mean, just so many cool things that exist in nature. Well, thank you so much for being part of the podcast. It's super interesting to have you, and I look forward to learning all about this new class, at least for me, of therapies so that I can enact it in my practice. And thank you to everyone who's listening as well to the podcast. Definitely leave some comments behind. I mean, I think this stirs a lot of discussion and a lot of new ways of approaching things. So I'm just absolutely fascinated by the folks that I get to talk to. So thank you guys for being here. If you like what you hear, please like and subscribe to the podcast. I'd love, as I mentioned, to hear your comments. So thank you, everybody, and I'll catch you next time on the Curious Cardiologist podcast. Bye.